Hi, my name's Diane. I'm a palliative care clinical nurse specialist. I work within palliative care within a hospital setting. I started palliative care 25 years ago. After I qualified, I got my general nursing mainly in medicine and respiratory and HIV. I then went on, decided that palliative care was where I wanted my career direction to go in. So I then got a post within a hospice and worked 3 years within a hospice setting, gaining experience within palliative care. I then, after working within a hospice, went to become a lung clinical nurse specialist, specialising in lung cancer. I then moved into the community and I spent 10 years working in the community, seeing patients within their own homes, looking after patients with multitude of life-limiting illnesses, looking after their symptoms, family support and end-of-life care, and allowing people to die in their own homes or transferring them to hospice if that was where they would wish to be. I then came to Bromley in 2007 and have been in the hospital palliative care team ever since, looking after patients within the ward setting, patients that are perhaps coming to their end of their lives, looking after patients that are dying within hospital or able to get them to their preferred place of care, or looking after their symptoms and referring them on to the community once they go home.
My name's Kay and I'm a palliative care nurse within the hospital setting. I started off with my nurse training and did medical and surgical wards and ended up on a haematology oncology ward as a ward sister, and from that post I realised that I preferred the palliative aspect of the care rather than the acute haematology, even though that overlapped, and I went from the acute hospital setting into the community as a community palliative care nurse with a hospice, which I did for 8 years, and I moved back into the acute hospital setting about 3 years ago to join the hospital palliative care team as well. What was my advice to you about following a career in palliative care would be, initially upon qualifying, trying out a few different settings and seeing what you enjoy and what you like. Palliative care patients are found in whatever speciality you work in. People unfortunately do become very unwell on all wards, and some patients will come to the end of their life whilst in hospital. So get a good grounding in general nursing and find out what's the right route for you. As I said, I started in haematology and found that the palliative care aspect of that was something that really interested me. Before I started nursing, I did some volunteering work in sheltered accommodation for older people, and also did do some work within a hospice setting. Just check what ages you need to be to work in those settings, but get some general experience of just looking after people and being supportive to them, and see if this is the right route for you. With regards to palliative care, I then did various courses that were related to different aspects of palliative care that could be applied to the general ward setting, and took it really from there. Decided I wanted to try the community first to see people who wanted to spend the last few days or weeks at home and care for them there and within a hospice setting, but have now moved back into the acute care, where also we can give palliative care within the hospital, or as Diane has said, aim to get people back to their own home if that's their wishes.
Why would I recommend palliative care? Palliative care, I feel that end-of-life care is very important, and it should be taken just as important as we do with midwifery and giving birth. I think people should have the same equitable care from cradle to the grave. I feel that I'm able to give something back. I think it's a privilege to look after people that are towards the end of their life and able to listen to them, to give the time to them, to support them, to make their end of life journey as comfortable as possible, supporting their families and their loved ones through the most difficult time of their lives.
The palliative care team within the PRU does a 7-day-a-week service, so there's always a trained nurse here, Monday to Friday and Saturday and Sunday. During the week we have on-call consultants within the team, Monday to Friday, but at a weekend it's a clinical nurse specialist on her own with a consultant on call via telephone. We see patients on every ward within the hospital and in intensive care. We only see adult patients aged 18 and above, and we don't go to the midwifery unit or the children's ward. We see patients with varying symptoms. Some of them it could be we're managing a symptom like pain or nausea. Some of the patients it might be that they are coming to their end of their life and they either want to be at home, so we help support get them home, or they might want to stay within the hospital setting or be transferred to a hospice, and we support that. We also have many members of the multidisciplinary team come and join us for a morning or an afternoon and come round the hospital with us, seeing what our job entails, and that can be from student doctors or nurses to healthcare assistants to doctors to OTs and physios and anybody else really that wants to find out what the palliative care team does. We also participate in teaching within the hospital, again for junior doctors and nurses and for other allied health professionals. We attend meetings in other specialities and have a visible presence there, maybe like in the frailty team or with the lung or breast MDTs, and support them and do joint working, often doing joint visits with the other specialist nurses to patients that we might all be involved with.
What's the hardest thing about my job? It can be very emotional. Within our team, we always have days that we have particular bad days, especially when we have got close to a patient. I always believe that you have to care to give the care, so you do give some part of you to that patient and open yourselves up. However, we work within a very supportive team. We have clinical supervision, so we're able to discuss any frustrations that we do have or any concerns that we have had, or any particular patients that might have left their mark on us. We're able to discuss that, and we're very supportive of one another. We also, the other more difficult part of the job is sometimes the frustrations of other healthcare professionals not recognising when a patient is coming to the end of their lives, but usually we're able to come with a compromise and able to discuss it within the teams and come up with a plan.